Dr. Chow is a dental implant doctor at NUVIA Dental Implant Center, and she's going to share the top 3 most important facts about dental implant pain, with the last fact tackling the question, is there actually a way to avoid pain altogether? But I know what you're thinking. You want to hear from someone who's actually had this done. So stick around and we're going to ask a patient what they thought of the pain related to dental implants. Number 3.
One of the most common questions I'm asked is, will this hurt?
Oh man, is this gonna hurt?
Before I answer that, it's important to know how getting dental implants work. Many people think that there's a ton of nerves in your jaw bones, but the reality is most of the pain from surgery is actually caused by inflammation and swelling, which is a normal physical response to surgery. The swelling and the discomfort is what causes a lot of pain because it stimulates the nerves that are around the area and the site of the injury. This is a typical CT scan of a patient, and this is specifically called the panoramic view. The nerve canal that is the big one that you're going to want to stay away from when placing dental implants is located in the lower jawbone. This nerve is called the inferior alveolar nerve, and it's very careful that you stay away from this region when placing dental implants to avoid paresthesia or any sort of nerve damage. Everybody is going to be a little bit different. Your body is going to also react differently to injury and therefore pain. And you'll see many times that in a doctor's office, the pain chart is on a scale of a 1 to a 10. And some people may be more sensitive or other people might be less sensitive. And you can see that that can range from a 10 while others are at a 3. Pain is very subjective to the patients and how their body is going to react.
Curious what your CT scan might look like and if you'd be a dental implant candidate? Take our 60-second quiz below. Number 2.
Another question I'm asked is, how long is pain going to last after surgery?
How long does it usually take?
Many patients believe that after a surgery like this one, you might be in pain for months, but that's simply not usually the usual case. You can expect the worst of the pain or peak pain to reach about 3 days out from surgery. Because all the inflammation and the swelling and the soreness will still be present around that time. And then thereafter, it starts to taper down. Usually within the first 2 weeks or so, or 10 days post-op, you can expect the gum tissues to start to be healing, stitches to kind of come dissolve, and then it's about around that time that you would come in for a follow-up for us to make sure that things are healing appropriately.
Number 1.
So the number 1 question regarding pain is there a way to actually avoid pain altogether? And the short answer, unfortunately, is no. But there is a way to lessen the pain and to lessen the discomfort that you might be feeling by following a simple pain management guideline that is set up by your provider. For example, one thing can be to use ice right after your surgery and keep that ice pack on and off every 15 minutes. And this can do 2 things. It can reduce the amount of inflammation and swelling that is occurring around the surgery site, as also cold can help provide almost like a numbing kind of sensation to help you lessen that discomfort. Another thing is to consume plenty of fluids and to keep up good nutrition. You can't heal if you don't properly feed your body. Another thing is to follow all the instructions from your provider in terms of how to utilize the pain medication. And every patient might be a little bit different in terms of how the pain is managed with medications. Following everything that I just said in this video, it won't completely erase the pain, but hopefully it'll make your experience a little more comfortable overall.
Now let's hear from a real patient who's undergone NUVIA's dental implant procedure and how they navigated pain after surgery.
I thought I was going to be miserable, and it was crazy. It never did really bother me that bad. I mean, I had some pain medication that I took occasionally, but that was just to relieve the little bit of pain I had, and after a week, it was all gone.
Probably the number 1 question I'm asked, not regarding pain, is how long does it take to get all new teeth? In this video, we take a deeper look into the 5 surprising things about all-on-4 dental implants.
It was a lot better than I thought. A lot better.